On the 23rd update of the President of the Republic, Nana Acquah, on COVID-19, he made some assurance that by March the country will receive its first COVID-19 vaccine of a capacity of 2 million plus. With this, many people have been raising concerns about the vaccine and its own complications that will be in the country. But with the latest developments, Dr. Omane Boamah is making an allegation that he's so surprised that people with complications in their health and then aged won't be vaccinated. He raised a number of issues, and we'll be talking about that here on Broad Daylight. This and COVID-19 and matters arising is our topic for today. My name is Priscilla More. Stay tuned, and my sister Lydia will help me with the site review. Over to you, Lydia. What do you have on cmonline.com.gh?
Okay, Priscilla, good morning.
Good morning. I'm very fine, and you?
Okay, good morning to our viewers and everyone watching us. Well, moving on to cmonline.com.gh. On our first story, we have NANMO must leave COVID-19 protocol enforcement, NGO to government. According to them, any police for response for corona restrictions. So, NGO, they are putting the government that is true. Let NANMO lead the COVID-19 enforcement.
Okay.
And also, COVID-19, it won't marrow shocking Ghanaians with underlying conditions. Aged won't be vaccinated. Omane Boamah. So basically, I got this story now. How do you say it? Say, people are assuming say if the vaccine come now, aged no, only never see because like their system is weak and all that.
I think we'll be going much more deeper when we get to the discussions, because this is a very delicate issue.
Yeah. And also, Ghana's COVID-19 death toll hit 464 with 765 new cases. As time goes on, the case keep increasing. When I check Ghana for young keep social like distance maneuver, wear your nose masks, wash your hands frequently. And also follow safety protocols to reduce spread of UK COVID-19 strain. Ghanaians advice.
So COVID-19 it's
baby,
that is what is actually trending.
Yes. The Ghana for one boy home because corona is real. As of now, people can move to corona and home. Obi a minimum, Robert, minimum. No mask and go and share and then about yours. It's not nice. Wear your mask. Because Charlie Corona we never real. Well, I think that will be all for the site review. Where the cmonline.com.gh. You watching us, if you want more story, the details of this story, visit our website, cmonline.com.gh. Facebook is CMGATV. Twitter at CMGATV. And Instagram is CMGATV. My name is Lydia. Go over to you, Priscilla.
Thank you so much, Lydia. Okay, let's get straight to business of the day. I am here with Lydia, Acquah, and then Sika, Beatrice. They'll be helping me with the site review for today. Charlie Corona Muhun is saying, then Acquah, are you educating your people anywhere you find yourself?
Oh, we are doing our best. Yeah, because corona is real. Even though people still don't believe it, it's real. So me, I'm doing my best. Yeah.
Oh, alright.
We are still telling Ghanaians say cases no rise and rise, so they should also do their part in protecting themselves, so that anything can say or mine.
Can say it.
I tell you that.
I tell you, and I see an idea. Anyway, let's move straight to the topic of the day. COVID-19 is coming with a vaccine, and people have actually tried and tested in their countries. If we listen attentively to the 23rd update of the president, he made mention that by March or June, we have our own vaccine for a capacity of 2 million. Over 2 million. Okay. So right now, there are so many complications coming with this whole vaccine.
Yeah.
Some people don't believe, some also believe it. And the latest development is from Dr. Omane Boamah. He's also saying that he has read somewhere that the aged and then people with underlying health conditions won't be vaccinated. What do you make of that, Lydia?
Oh, okay, first of all, it's a rumor.
Okay.
It's not confirmed. So I think so he's urging the government to publish people who are qualified to take the vaccine. I think that will be okay. Because with the radio crowd, if not a vaccine, when access you'll be here. I think the Ghanaians are confused whether the vaccine is for everyone. I think the best thing is for the government to publish people who will be qualified to take the vaccine. Because me too, as a means they can hold same penny for some more yarn or more no better vaccine. I don't know, say, we now corona crowd, which mean your vaccine there. Me, I don't know. So I think say them educating us about the vaccine more because we do cross it that some complications, erectile dysfunction, all that I think the vaccine on side effects in more seeing we know. It's not a really I think that the government publishing or making us aware of people who be qualified for the vaccine. I think say it's good. Because Mr. Omane, why confused? It's not sure way it's about government. So I think say first of all, I saw the aba. Now you publishing on COVID-19. You buy no next update and I say we know. My who vaccine people who are qualified to take the vaccine.
Okay, Beatrice, what do you make of this?
And before anything else, no, we have to know say there are rumors and speculations. President Nankasa and government no shed and far statements and Abibi and buy say indeed vaccines no such people qualify and then such group of people don't also qualify. So for now, no, let's not try and then my kind so we are just urging the government say bibi no de beba bontin who the people who qualify for these vaccines are normal Ghana for you because the rumors are just getting out of hand.
Okay, but don't you think that the vaccine maybe are needing too much? Maybe I will share other countries how they are responding to the treatment of the COVID vaccine. It's some way. That's why maybe people also raising the alarm say maybe oh yeah that any same amount of vaccine it's going to maybe weaken your system or bring other complications.
Media I think say vaccine never no doctors no make sure say right patients never the vaccine. Yes. And like they won't stand up and say we are more vaccine. And I won't say uncle I want get vaccine.
Right now we are still waiting for the categorization.
And we have health aspects in this country.
Yes.
So president need to mean sorry preoccupying say without the health aspects not examining and then doing their necessary research and all that. So it's not make us say bibi any na you won penny for mind we have penny for umunim enjoying muni their researchers near there so they will do their best to ensure say minjin this on be say Ghana for the health be call at risk and visa. So let's just relax and then wait on them.
And I was sure the second wave, that's the new variant, is now in the country. And according to the director of West African Center for Cell Biology of Infectious Pathogens, our University of Ghana, he's also making an allegation. The name is Professor Godwin. He's making an allegation that we have to really take care of ourselves because the second variant is very fast when it comes to spreading, and then it's now predominant in the country. So what advice do you give to people watching us, people who take their nose mask off, not adhere to COVID protocols and stuff like that? Because as a Ghana for if I see a deal who answer we do what it's said.
Then I'll say we do any who be.
What's the second? Looking at the it's a rule for no outsiders now. People outside the country now. How the second wave is really dealing with them now. What do you think Ugandans should take very important? As doctor is also trying to say here.
Oh, okay. Me the first of all, I think it's Ghana for you try your best because I never take over no be actually no smarts. I find it serious because the thing I report if you outside the ban, the thing is serious and you say you hear say the thing is there. And we have parliament to cry. And when you corona.
Yeah, and then all company I say they are going virtual. And then parliament will be sitting twice.
So sure,
Tuesdays and Thursdays.
It's gonna for born who buying no smarts in a share. You must almost want to mean home. It's better so much on your say I could ICU nobody at home. Choose your choice. I mean,
sacrifice. A little sacrifice can go a long way.
But people also saying that with this whole mask thing, assume and I say, oh home heat. Now I sound so heat now. We sound so actually heat now. Police need be the driver. And I say, why are you not wearing it? And I say, buying. I did who say in heat you cool me. Now I can't sound so sandy PA. Me no want to hear. I about funny mom we are in buying. They know all this. And almost see marks.
Yes.
What do you buy you? Although I show more that no. It's better so be share. Na should be do so buy ya obenya ko.
And I will impress la Max na yan car say share will baby a obeko. Who are public places. Who baby a oni nipa wa. Minjin this oh feel all them our marks.
Exactly.
Yes. You see, so make this little sacrifice just for your own being. Because you're any be out you don't care about yourself or family member be or relative be if you are now the sign. So we are just urging the public, protect yourself. It's for your own good. It's for your own good. So let's just try our best to keep up with the precautionary measures and then the protocols.
Oh, okay. When the president gave its 23rd update now, people were saying he said restrictions or the man church now. I said, we just move it on. We almost say, I said, 25 persons spend a bit me for weddings and funerals. And so other than a church there, we see they can go in their numbers, but still adhere to the COVID-19 protocol.
We saw churches now. Church one Sunday school when they pass.
Okay, they have programs
and all that.
Yes.
But I think that if going to church now, we adhere to all these protocols. I think that's better.
It's better.
And even if you listen to Ghana Health Service, according to their data, they don't recall cases
from churches.
They said open area, maybe a ventilation wall. They don't record cases there. And then this morning, according to Christian Council, they are saying that the pastors and the congregation, everybody should adhere strictly to the COVID-19 protocol. Nobody should have funeral with about 25 persons attending. When you go to church, make sure that you are in your mask. They should take temperature, they should take attendance, and all of those things. So right now, let's talk about the COVID-19 death. Now the death toll is now 464. 464. Let's just use this point for you to speak to the general public.
Oh, okay. First of all, if you look at the death toll now, I think yesterday is almost different from this one. That every day it keeps increasing. It's Ghana for my boy and mine. Corona na ho. We shall outside. It's more lockdown. The thing is still increasing. I'm sure maximum. Na young who and so frequently. As I said, I'm going for almost every move because we shall mass and almost every. My sisters, but
I can't so you're any kind bow, my son and I in your bro. Yes, I relaxed. And at first, no snack coming in is a baby or could be on Veronica buckets in a stand, but it says Swati, I don't know what's going on.
I think that because they're in the maximum, they think say they are okay. No, but I think wash your hands frequently.
It's very important. If your hands are dirty, infected, now they can't max no. Well, they can't mask the creating a crampon. You are touching your face. I don't know. Just keep your hands clean. A bump and your hands now you're washing it very, very, very important. Because once any pile high and satire cocoa in idea. So I'll just plead with them. Young bomb or Diana measures no yen diso. Washing your hands. How many minutes will it take you to wash your hand? Yes, and our sanitizers too. Let's make sure we have our sanitizers with us all the time, because if you are able to be Veronica buckets, you just use your sanitizer and then keep yourself neat and then Charlie, stay safe.
No, so it should be alcohol based. Sometimes we want to I said, oh, band just like a Charlie. And I'm not smart, but I want to when I see you or be the or the tuna when I see my name. So
you cry about Jenna. I don't know if you are putting it, then just take it off.
Then I think they're covering the hair. They're covering the hair. The hair, no more.
It's very bad.
I mean, you say, pause, never about you, the covering the very far. My father getting cut out and so on. What the tongue when I asked him, he said, what's your space for my
It's not like at all.
I think the Ghana Health Service should still go on with their education because still now people are people are still doing things the wrong way.
We have to actually commend the Ghana Police Service for the initiative they have brought. Yeah, chill. Now you pay a penalty.
That's good. That's good. It is
a
now we bet you a penalty, no. Now we shall marks are. With your consolity, baby, I'll be your bet here.
Both ought to come one and not massing than a body. We say, no, wash it.
It's very bad. Listen, down the school, need be an it's now calm. Police need to not come on say, school girl, where is your marks? Then I'll say, it's here. Oh, yeah, meaning so be shampoo. Police need to train on our board and ashes, and police need to social girl no come. Or see, you don't respect foolish girl. Where is your marks?
Wow.
After Juana or the Ashanity, your pound while we max. Mammy not in the chance say, hey, was soon you didn't want. And no police in the catcher say, I hear you, me see for man, my tough for. It's I feel so, why are you even holding it at the first place? So better you couldn't get it. What's not come into go do school more and what a man's a shana day.
We're going to
it's a yaw phone so and she'll say, on money free fear. Just say when you know will be more alcohol based sanitizers name on maximum. Not Charlie.
Yeah. Over the weekend, Acquah International School, they've recorded 40 persons on COVID-19. It's 40 students. It's a big school. It's according to reports, a parent tested positive, and they called the school that they have tested positive. And quarantine and quarantine will be a test. They conducted a test of about 500 people, and then 40 tested positive for the COVID-19. So like it's an initiative that also. So I think this will really help. Why I didn't say me as some of you cooking the who and I best stereotyping me about our school. If you get a development like this now, you let the school be aware and then they do the necessary action. So they said they will communicate to the media anytime there is an increase in the test too.
And I said, not
stigmatization.
Yes.
You know the world we are living.
Is that the education had to really go down?
Yes.
Education has to really go down. It's been a long time for me who say we are PA system, me and I can't be trim and information center for you when you must speaking about COVID and all that. Aside the media, I've not really seen any of these MCs and NMCs and communication, and they're just there. Some way one of them who they are fine, but so far as I'm concerned, more villages rural areas Charlie. By this time, the education should go down well with them.
And could you believe say disposable must be museo? Disposable. No, see.
The word is disposable.
Like, I was wondering, say, like, they don't understand the disposable or who is kind of no smart.
Yes, people miss camper. You can go for the it's washable. Yes, you can go in for that one.
I say, oh, it's disposable.
Yeah, hata. I didn't know women is supposed to do that now. Like it becomes weak naturally.
You should dispose this.
Oh, okay. So thank you so much for your thoughts and your education on the topic for today, especially with the COVID-19 vaccine. And so, Mr. President, please. People are raising too much allegations and too much rumors in town. We just hope that you will come and tell us what it is, because everyone is anticipating for the COVID-19 vaccine, but we believe that there should be measures in place so that everybody knows. Thank you so much for watching us on today's Body Light. I was here with Lydia, Acquah, and then Sika, Beatrice. My name is Priscilla More. On our next episode, we call it a day.